Hello everyone. We are going to discuss the medico-legal management of COVID deaths. COVID-19 pandemic is one of the biggest medical crises our world has ever seen. It crippled the world's healthcare system, even including the best ones. Indian healthcare system also went through the same fate during these times. Handling dead bodies has been one of the biggest challenge for every country, including ours. Handling a dead body with a COVID tag would run chills down the spine of anyone who would be in the front line. The forensic medicine experts faced issues related to conducting post-mortem examination on broad dead cases and themselves got exposed while doing the same. Changing treatment protocols and handling medical and administrative issues, ensuring all relevant ethical norms and keeping in mind various laws along with ensuring control of spread of disease has been challenging to all. The steps to dead body management are as follows: transferring body from the isolation area to the mortuary. The precautions to be taken while doing the same are: the health worker handling dead body should perform hand hygiene, ensure proper use of PPE. All tubes, drains, and catheters on the dead body should be removed and disposed in triple layered yellow plastic bags for incineration. Any puncture holes or wounds should be disinfected with 1% hypochlorite and dressed with impermeable material. Apply caution while handling sharps. They should be disposed in 2 sharps container. Plug oral, nasal orifices of the dead body to prevent leakage of body fluids. All used or soiled linen should be handled with standard precautions, put in biohazard bag and the outer surface of the bag disinfected with hypochlorite solution. Used equipment should be autoclaved or decontaminated with disinfectant solutions. Place the dead body in leak-proof plastic body bag. The body bag can be wrapped with a sheet. If the family of the patient wishes to view the body at the time of removal from the isolation area, they may be allowed to do so with the application of standard precautions. All medical waste must be handled and disposed of in accordance with the biomedical waste management rules. The health staff who handle the body will remove personal protective equipment and will perform hand hygiene. Now the next step is transportation. Precautions to be taken while transportation are: the body secured in a body bag, exterior of which is decontaminated, poses no additional risk to the staff transporting the dead body. The vehicle, after the transfer of the body to cremation, will be decontaminated with 1% sodium hypochlorite. Next step is cremation. The crematorium or burial ground staff should be sensitized by Public Health Department that COVID-19 does not pose additional risk. The staff to practice standard precautions of hand hygiene, use of mask and gloves. When the body is handed over to the police and relatives after autopsy, then they must be advised not to open the bags or touch the body and not to gather together to minimize spreading of infection. The burial staff and family members should perform hand hygiene after cremation. The ash does not pose any risk and can be collected to perform the last rites. Large gatherings at the crematorium should be avoided. The death in hospital or under medical care due to COVID-19 is not a medico-legal case and no forensic autopsy will be conducted. The certification of death and issuance of medical certificate of cause of death will be done by the treating doctor. If autopsy is to be performed for special reasons like suicide, homicide, accident, custodial deaths, allegations of negligence in treatment, the following infection prevention control practices should be adopted. The team should be well trained in infection prevention control practices. The number of forensic experts and support staff in the autopsy room should be limited, preferably to 1 doctor and 1 support staff, to ensure judicious use of human resource. The team of doctors who would be involved in autopsies should be trained in collection of nasopharyngeal and oropharyngeal swabs or swabs from bronchial tree and also blood for culture. The chief of mortuary services should make provisions for adequate number of PPEs, instrument sets, culture bottles, VTM with swabs, plastic body bags and linen, and 1% sodium hypochlorite. Human resource to prepare duty list so that staff is used sparingly and with adequate rest so that they are available whenever required. The team should wear proper PPEs, which includes coveralls, head covers, shoe cover, N95 mask, goggles, face shield. Round-ended scissors should be used. PM40 or any other heavy-duty blades with blunted points to be used to reduce prick injuries, only one body cavity at a time should be dissected. Unfixed organs must be held firm on the table and sliced with a sponge. Care should be taken to protect the hand. Negative pressure to be maintained in the mortuary. An oscillator saw with suction extraction of the bone aerosol into a removable chamber. Avoid spillage of body fluid during autopsy. In case of spillage, wash immediately and clean with 1% sodium hypochlorite. Instruments should be kept in 1% sodium hypochlorite. After the procedure, body should be disinfected with 1% sodium hypochlorite and placed in a body bag, the exterior of which will again be decontaminated with 1% sodium hypochlorite solution. The body thereafter can be handed over to the relatives' autopsy table to be disinfected as per standard protocol. The postmortem specimens suspected for COVID-19 deaths are nasopharyngeal or oropharyngeal swab, lungs fixed for histopathology if applicable in COVID protocol, other organs depending on signs and history if applicable in setup. So this is a short video demonstrating the same.
Experts stress care while handling the dead. The Health Ministry has issued guidelines for the disposal of bodies, while noting that an increased risk of infection from a dead body is unlikely. For infectious diseases, the World Health Organization prescribes various biosafety levels with bodies, medical gear, and disposable. For bodies of dead COVID-19 patients, the WHO is mandating BSL 3. By BSL 3, ideally, bodies must be packed intact in leak-proof plastic and cremated. The ministry advises families not to hug, wash, or kiss the body. Embalming and unzipping the packed body must be avoided. WHO and AIIMS advise cremation unless a family insists on burial for religious reasons. During burial, family is advised to not touch the body. The ministry has issued guidelines for health workers, such as hand hygiene, use of personal protective equipment like water-resistant apron, gloves, masks, eyewear, and disinfection of the bag housing the body and linen. The lungs of a dead COVID-19 patient, if not handled correctly during an autopsy, can be infectious. To prevent contact of doctors and mortuary workers with the deceased's body fluids, an autopsy must be avoided unless required. If autopsy is a must, one has to wear protective gear and then disinfect the entire autopsy room, including instruments,